You think pirate amputation was just desperate butchery by drunk sailors with rusty cutlasses?
But here's the shocking truth that will completely change how you view these legendary sea raiders. Battlefield amputation wasn't crude last resort. It was the difference between walking away or bleeding to death.
The most successful pirate crews had developed surgical techniques that would impress modern trauma doctors today.
Hollywood has completely lied to you about pirate surgery and those casual limb removal scenes. Real pirate amputation was precision work, performed under impossible conditions by skilled medical practitioners.
These men understood they had one chance to save a life before their crewmate died.
The pirates who became legends were part of crews that mastered brutal battlefield surgery.
These weren't accidental discoveries. They were refined techniques passed down through pirate generations.
Knowing how to remove shattered limbs in 10 minutes meant losing one member versus half your team.
Cannon blasts created injuries so catastrophically devastating that victims had minutes before permanent body shut down. We're talking limbs hanging by skin strips, bones shattered into dozens of bloody pieces.
Arteries spurted blood like broken water pipes, while enemies continued shooting at wounded pirates.
Modern trauma medicine talks about golden hours, but pirates only had precious golden minutes. A cannon-mangled leg gave pirates 5 to 8 minutes before irreversible shock and death.
There was no time for examination or planning plus. Surgeons had to start cutting immediately.
The triage decisions were absolutely brutal, while cannons still fired around wounded crew members. Surgeons instantly categorized injuries: savable with amputation, treatable with first aid, or beyond help. Getting split-second decisions wrong meant losing savable lives or wasting time on hopeless cases.
Pirate surgeons learned to recognize injuries requiring immediate amputation versus those causing slow death.
Limbs with severed arteries, crushed bones, and massive tissue damage demanded aggressive surgical intervention.
They developed grim expertise, predicting which injuries would kill pirates slowly versus quickly.
The psychological pressure was incredible, making life or death decisions while their own lives remained threatened. Battlefield surgeons examined mangled limbs, while musket balls whistled overhead and cannon fragments crashed. One moment of hesitation could mean watching a friend bleed out while paralyzed by indecision. Pirates performed life-saving amputations while ships remained engaged in active, deadly combat situations.
Picture making precise cuts while your floating operating room pitched violently in rough seas.
Enemy cannonballs smashed through decks while surgeons worked in smoke-filled, screaming chaos. Ship movement created incredible challenges. Surgeons timed cuts with the vessel's rolling motion. Pirates made critical incisions during brief moments when decks were relatively stable and secure.
Badly timed cuts could sever preserved arteries or fail removing tissue, causing fatal infections.
Combat conditions made surgical sterility completely impossible on blood-covered, debris-scattered battle decks.
Tools were contaminated with seawater, dirt, and blood from previous wounded patients. The operating environment was opposite of everything modern medicine considers essential for surgery. Legendary pirate surgeons completed life-saving amputations while literally dodging incoming enemy fire. Stories survived of doctors finishing limb removal while cannonballs crashed around them.
Some continued surgical procedures even after taking minor wounds themselves during ongoing battles.
These men had steel nerves and hands, steady enough for precision work under terrifying conditions. Some battles lasted hours, meaning surgeons worked continuously on streams of casualties. They'd complete one amputation, move to the next pirate, and repeat dozens of times.
The physical and psychological endurance required was absolutely superhuman under combat stress.
Surgical tools were ingenious adaptations of everyday ship equipment, modified through trial and error.
These weren't purpose-built surgical tools. They were creative solutions using available ship materials.
Cutlasses became surgical saws when properly sharpened and modified for precision medical cutting. Pirates honed blades to razor sharpness, creating edges that sliced through bone, minimizing trauma. Curved cutlass designs worked well for amputation cuts, following natural body contours perfectly.
Heated metal plates from ship fittings became cauterizing tools for sealing blood vessels. Pirates heated plates until red hot, then seared closed major arteries, preventing fatal hemorrhaging. The technique was brutally painful, but incredibly effective at preventing patients from bleeding out. Rope tourniquets were probably the most important surgical tool pirates ever developed for surgery. They learned specific knots and pressure techniques, stopping arterial bleeding without damaging healthy tissue. Pirates fashioned bone saws from carpenter tools, modifying wood-cutting instruments for human bones.
They reshaped teeth, adjusted grips, and created specialized jaws gripping bones during cutting. Skilled pirate surgeons could remove limbs faster than many trained doctors on land. Needles came from sail-making supplies, while thread was improvised from rope fibers.
Pirates sterilized makeshift sutures using heat, alcohol, or salt water, creating surprisingly effective tools. Creative pirates developed specialized clamps from metal fittings, creating tools gripping blood vessels.
These homemade surgical instruments were often more effective than crude medical tools available.
Before amputation, pirates solved enormous pain management challenges without access to modern anesthetics. Techniques combined physical, chemical, and psychological methods, rendering patients unconscious during painful surgery. Alcohol was obvious, but pirates learned simple drunkenness wasn't enough for major surgery.
They developed specific dosing techniques, achieving unconsciousness without causing fatal alcohol poisoning.
The goal was finding sweet spots, where patients felt no pain but remained alive.
Leather bite blocks prevented patients from biting through tongues during excruciating pain spasms.
These weren't Randall leather pieces. Pirates crafted specialized guards fitting comfortably in mouths.
Some bite blocks were soaked in rum or treated with numbing substances, providing additional relief.
Pressure point techniques rendered patients temporarily unconscious through precise neck and head pressure. These methods required extensive anatomical knowledge and perfect timing for several minutes unconsciousness. Opium was occasionally available when pirates raided ships carrying medical supplies or exotic cargo.
Pirates understanding proper drug use could provide genuine anesthesia, making amputation surgery humane.
However, dosing was extremely dangerous, and overdoses could kill patients faster than injuries. Patients might receive alcohol, pressure point unconsciousness, and bite blocks, creating layered pain management.
Desperate situations required physical restraint systems, where crew members held patients during amputation.
Pirates developed specific restraint techniques, immobilizing patients without interfering with surgical work.
Timing became crucial. Coordinating anesthesia with surgery ensuring unconsciousness during painful amputation.
Not every pirate had temperament, skill, or stomach for brutal battlefield amputation surgery.
Some pirates developed combination techniques using multiple pain management methods simultaneously for effectiveness.
Smart crews identified individuals who could handle surgical duties, becoming invaluable crew members. Ship's cooks made excellent surgeons with knife skills, steady hands, and tough material experience.
They understood anatomy from butchering animals and were comfortable with blood and dismemberment.
Carpenters brought precision cutting skills and experience with how materials responded to tools. Wood shaping techniques actually translated surprisingly well to shaping bone and tissue during surgery.
Former barbers were incredibly valuable because barbering included tooth extraction and minor surgery. These men brought actual medical training and proper surgical tools to pirate crews. Psychological requirements eliminated many capable pirates who couldn't handle causing pain to friends. Battlefield amputation required stomach for horrific injuries and strength for split-second life decisions.
Most legendary pirate surgeons were men who'd failed at other professions on land.
These outcasts and criminals discovered natural surgical talent that saved countless pirate lives. Respect for skilled ship surgeons was genuine. They meant lower casualty rates. Crews with competent surgical specialists survived battles, meaning more pirates shared treasure. Smart captains protected surgeons as carefully as navigators, understanding medical expertise's life-saving value. Training surgical assistants became ongoing process. Experienced surgeons taught willing crew members.
The actual amputation process was carefully choreographed sequence, requiring perfect timing and precision. Every successful ship surgeon learned this life-saving procedure by heart, without hesitation. The first step involved rapid assessment and tourniquet application, stopping arterial bleeding immediately.
Pirates identified major blood vessels and applied effective tourniquets in under 30 seconds.
Initial blood control bought precious time for the complex surgical work that followed.
Positioning and restraint came next. Crew members held patients while surgeons prepared tools.
The goal was immobilizing patients without interfering with surgical access or causing injuries. Pirates developed specific holding techniques for arms, legs, and hands, keeping patients secure.
Cutting sequence followed anatomical principles pirates learned through experience rather than formal training. Each tissue type required different cutting techniques and tools based on available equipment. Bone cutting was often the most challenging part of the entire surgical procedure. Pirates learned to slice through bones cleanly, without splintering or creating jagged edges. They started with skin, worked through muscle layers, and finally tackled bone removal. Skilled surgeons made cuts so clean they looked like professional medical tools created them. Cauterization immediately followed amputation. Heated plates sealed blood vessels, preventing fatal hemorrhaging.
This was arguably the most critical part, since patients could still die from bleeding.
Pirates worked quickly, while cauterizing tools remained hot enough to be surgically effective.
Wound dressing and bandaging completed surgery, using whatever clean materials were available aboard.
Pirates created effective bandages from sailcloth, treating them with rum, preventing infection.
Entire amputation process could be completed by skilled surgeons in under 15 minutes.
This speed was essential since prolonged procedures increased shock, blood loss, and death. After surviving surgery, patients faced enormous healing challenges aboard floating disease factories. Techniques pirates developed for post-amputation care were surprisingly effective, combining wound management.
Infection prevention became primary concern, since infected sites could kill weeks after surgery.
Pirates cleaned wounds regularly using rum, vinegar, or boiled salt water, creating antiseptic solutions. Pain management during recovery relied on alcohol, opium, positioning, massage, and distraction methods.
Managing pain wasn't just comfort. It was essential, since agonized pirates couldn't heal.
Nutrition became critical, and ship cooks prepared special meals for recovering amputees.
These patients needed extra protein and nutrients, receiving preferential treatment for fresh food.
Prosthetic development started immediately, with carpenters creating wooden legs and hook hands.
They changed bandages frequently and inspected healing sites for dangerous infection signs.
These weren't just functional devices, they were works of art, reflecting wearers' personalities. Social support systems around amputation recovery were genuinely heartwarming aspects of brutal life.
Crews rallied around wounded shipmates, helping with tasks and providing companionship during recovery.
Disabled pirates remained valued team members rather than burdens to be abandoned. Adaptive equipment allowed many amputees to return to full pirate duties surprisingly quickly. Pirates with wooden legs learned climbing rigging, fighting with weapons, and performing maintenance.
Those with hook hands developed incredible dexterity, becoming more effective fighters than before.
Psychological adjustment was supported by pirate culture's respect for battle scars and survival.
Successful amputees were viewed as toughness examples, inspiring crew members and enhancing reputations.
These incredible battlefield surgery stories reveal profound human capacity for adaptation and survival. Pirate surgeons weren't trained doctors, they were desperate men using improvised tools. Yet they achieved surgical outcomes, saving thousands of lives when most injured simply died. Scars and prosthetic limbs became badges of honor, telling stories of survival against odds.
A pirate with wooden leg was living proof his crew possessed life-saving medical knowledge. Visible survival marks became symbols of incredible human will and surprising medical expertise.
Techniques pirates developed through desperation actually advanced trauma surgery for centuries ahead.
Their tourniquet, amputation, and triage understanding informed medical practices in later wars.
Most remarkable was how crude surgical techniques demonstrated incredible human learning capacity.
Pirates became healers who risked their lives to save others in brutal circumstances.
Wooden legs and hook hands weren't just colorful details from adventure stories.
They were testament to sophisticated medical knowledge, separating successful crews from dying ones.
These survival symbols represented some of the world's most advanced trauma medicine available.
Pirate amputation surgery reveals something beautiful about human nature among society's feared outcasts. Knowledge, skill, and compassion could flourish when lives were at stake aboard ships.
Men performing desperate surgeries weren't just saving limbs and stopping life-threatening bleeding.
They were preserving the most precious treasure of all, human life itself.
Each careful cut represented the difference between death and another chance at survival.
These weren't random acts of violence, Press D. They were calculated medical interventions.
Pirates developed surgical protocols that would be recognizable to modern emergency room doctors. The speed and precision required exceeded what most people could handle under pressure.
Every successful amputation represented hours of prior experience and accumulated surgical knowledge. Pirates who mastered these techniques became legends, not for cruelty, but for compassion. They transformed from society's outcasts into the most skilled trauma surgeons of their era.
Battlefield conditions that would paralyze modern doctors became routine operating environments for pirates.
The psychological strength required to perform surgery while under fire was absolutely extraordinary. These men created medical miracles using nothing but determination and improvised ship equipment.
Their success rate for amputation surgery often exceeded what formal medical schools achieved.
Pirates proved that expertise could develop anywhere when human lives depended on it.
The bond between surgeon and patient created some of history's most powerful survival partnerships. Recovery meant not just surviving surgery, but adapting to completely new ways of living. Pirate crews became rehabilitation centers where disabled members learned new skills and techniques. The ingenuity shown in creating prosthetics matched the brilliance of their surgical innovations.
Hook hands and wooden legs became symbols of human refusal to surrender to injury.
These adaptations allowed pirates to continue pursuing their dreams despite devastating physical losses.
Modern trauma medicine owes debts to desperate innovations created on blood-soaked ship decks.
Pirates transformed horror into hope, turning potential death sentences into survival stories.
Their legacy isn't just adventure and treasure poems, it's advancement of life-saving medical techniques.
The medical knowledge developed aboard pirate ships influenced surgical practices for generations afterward.
Every wooden leg represented a victory of human ingenuity over seemingly impossible circumstances.
Pirates proved that compassion and medical skill could flourish even among society's most feared outcasts. These floating hospitals saved more lives than many formal medical institutions of their time. Pirates created surgical techniques that modern doctors study and admire for their effectiveness.
Their improvised medical tools often worked better than expensive equipment available on land.
The human spirit's refusal to accept death created some of history's most remarkable medical achievements.
In the end, pirate surgery represents humanity's greatest triumph, saving precious life, one cut at a time.